Good afternoon, everyone. Good afternoon. This is Joyce Fogler with Vantage Point Consulting, and I'd like to thank you for joining us on today's webinar regarding infectious disease and pandemic planning, particularly focused for the ambulatory surgery centers. As before, IFASC is sponsoring this training through the ASPR Emergency Preparedness Grant Funds, and thank you, Ann, for engaging us to do this with you. We do have all of the attendees on mute. If you have a question or comment during the webinar, you can write that in the chat feature on your computer, or at the end of the session we can unmute those that are still on the call and open it up for discussion. We will be providing certificates of training. If you are calling in and not on the computer, you will need to send us an email so that we can capture the fact that you are here, or if you have additional people in your office listening in, we'll need to know their names as well. However, those of you that are on the webinar through the computer login, we've captured that, and we'll be sending you a certificate for the training today. So our objectives for this particular webinar, we're going to kind of review infectious disease and pandemics, as well as how it impacts the surgery centers and the public health in general, review plans for infection prevention, and how your surgery center can be better prepared in case of a what we call high consequence infectious disease or a pandemic situation. This presentation is definitely geared towards dealing with infectious disease in the emergency preparation realm. This is not a presentation on all the infectious diseases that you may encounter within your setting, or the public health may encounter. And I have to qualify that I am not an epidemiologist or infection preventionist, so take that into account. Like I said, this is a focus on emergency preparedness planning and preparation for dealing with infectious disease and pandemic situations. So I just want to start out by giving a little bit, though, setting the stage with infectious disease. As you know, it's an illness resulting from an infectious agent or its toxic products. Organisms such as bacteria, viruses, parasites, or fungi are the typical pathogens that are causing these types of illnesses. Infectious disease is usually something that we consider highly communicable or easily transmitted. There are different types of transmission. These could be direct contact, person to person, or respiratory droplets through like sneezing or coughing on someone. Indirect contact is airborne transmission, or it could be vector-borne transmission, such as mosquitoes, bats, or monkeys. There are different diseases that all those types of animals carry, and if a human is bitten by them, they could get those illnesses. It could also be contaminated by object transmission, dirty needles, those types of things. And transmission can be natural, such as, mosquitoes getting a mosquito bite and then becoming ill. They could be man-made, and those are further broken down into accidental, such as a spill or a needle stick, or hopefully accidentally any kind of sexually transmitted disease would also be accidental, not intentional. But a man-made event could also be intentional, such as an anthrax attack or release, or some other type of aerolized pathogen in a bioterrorist type of an event. Depending on the type of transmission, this will help to determine what resources that we need to manage the disease, what personal protective equipment we need, what's the safest way to transport an individual with a particular type of an illness, and how that illness is transmitted, and what public health education needs to be accomplished to keep the general population safer. Signs and symptoms vary depending on the organism that causes the infection. However, in general, infectious disease includes fever and fatigue. There are obviously other symptoms that can go along that are much worse, depending on, again, the type of pathogen from the disease process. Mild infections typically respond to rest and home remedies, while some life-threatening infections do require hospitalization and can lead to death. Many infectious diseases, such as measles and chickenpox, can be prevented by vaccines. Frequent and thorough hand washing also helps protect us from infectious diseases. And this is, you'll see on your screen a URL for the Indiana State Department of Health that will link you to their Epidemiology Resource Center, which does list many, many different types of diseases and as well as infectious diseases. So when we're talking about the different types of pathogens that can be involved in infectious disease, the National Institute of Allergy and Infectious Diseases has developed a kind of a category system. Category A pathogens are those that pose the highest risk to national security and public health. They are easily disseminated or transmitted from person to person. They result in high mortality rates and have a major impact on public health. Things that fit into Category A are anthrax, Ebola was Category A pathogen, plague. So those things that we hear about that are just really devastating in the public health arena. The Category B pathogen is one that is moderately easy to disseminate and causes moderate morbidity rates and low mortality rates. Things that typically, there are multiple things, but some of the most common things that fit into pathogen Category B are Salmonella, Listeria, E. coli, hepatitis A, West Nile virus is a Category B, as well as some of the different encephalopathic types of illnesses. And then Category C are those that are easily produced and disseminated, and they could have a high potential for morbidity and mortality rates, but these might include tick-borne viruses, tuberculosis or TB, influenza fits in a Category C, the SARS and MERS, the severe acute respiratory syndrome and the Middle Eastern respiratory syndrome, SARS and MERS. Hepatitis C fits into Category C pathogen, as well as HIV and AIDS. So they're just classified by the how easily they're transmitted, as well as the impact they would have on the general public. This list is just some of the major infectious disease threats that are or have recently been reported in the United States. Obviously, foodborne illnesses, Salmonella, Listeria, E. coli, norovirus are some of the more common ones that we hear about. We always have to be worried about healthcare-associated infections like MRSA or C. difficile. Unfortunately, a lot of the pathogens are mutating and are now becoming superbugs and resistant to antibiotic attempts. Some of these that are more commonly Referred to are the carpenium-resistant Enterobacter ceci, and I know I apologize if I murder these words, but CRE. These are typically like pneumonia, bloodstream infections, urinary tract infections that many times are healthcare-associated infections also. Superbugs or antibiotic resistant, could be the multi-drug resistant Acinetobacter, could be MRSA, the vancomycin resistant Staph aureus, or Enterococcus, the VRSA or VRE are some of the more common ones we see in the hospital settings anyway. Obviously the flu, influenza, and they say that about 20% of the population in the United States gets the flu each year, and obviously we're worried about H1N1 and avian flu. We've had swine flu in kind of a more recent history that we've dealt with. They could also be from mosquito-borne, like West Nile virus has been known to be here in the central Indiana area. Tuberculosis is another one that's kind of becoming more resistant to drugs now, and that's a concern. As I mentioned before, the MERS, we have had travelers in Indiana from Saudi Arabia that did have reported positive for MERS. I don't believe there's been any SARS patients in the state of Indiana, but with the kind of open travel with the Middle East, that's always a concern. And we all know about the recent efforts that we've made in being able to manage Ebola if it did come to Indiana. This is just a list of some of the vaccine-preventable diseases, and I know there's a lot of discussion now about the safety and efficacy of vaccinations, and but still about 92% of the population in Indiana does receive childhood as well as appropriate adult vaccinations that are recommended. But these are just some of the diseases that could be prevented with better vaccine management. One of the terminology term that we hear quite frequently is called emerging infectious disease. And emerging infectious disease are those that have increased incidence in the last 20 years or have a potential to increase in the future. This can be because of new infections from organisms that have changed. It could be known diseases spreading to new geographic areas, and that's kind of what happened with the Ebola. It could be previously unknown infections. So one of the new ones we're dealing with now is the Zika virus. Or it could be an old infection reemerging due to antimicrobial resistance or a disruption of public health interventions. A couple of things that we're looking at in that category are the antibiotic-resistant TB, mumps, whooping cough, and hepatitis B kind of all fit in that area. So those are all considered emerging infectious disease, things that have increased in the last 20 years, have increased, or that we're worried could be coming. And unfortunately, there are new things that come up every year. We don't really know, and it's difficult to predict what that next pathogen or course of the disease process might bring to us. So when we're trying to manage these different types of infectious disease, it's very important that we work with our healthcare and community partners. And each district does have a healthcare coalition plan for dealing with emerging infectious disease and some of the things that are included in those plans. And if you don't have a copy of that, you need to work with your healthcare coalition in your district to get the plan for your area. But it does list the different types of risk exposure, and we, from the public health, we take actions based on risk factors. And for emerging infectious disease, the risk factors are based on what we call exposure criteria. These could be high risk, some risk, low risk, or no identifiable risk. And those risk factors are generally determined by the Center for Disease Control or the Indiana State Department of Health. Another aspect of the Healthcare Coalition's Emerging Infectious Disease Plan is talks about surveillance. And this is generally done by the local health departments. They may be monitoring individuals who are at risk but not infectious or ill to help identify early if symptoms do develop to help to prevent the spread of an infectious disease. So they could be doing active monitoring, direct active monitoring, or what we call self-observation, where the individual is just reporting to the local health department. Another aspect of the plan is information sharing, knowing what information can be shared related to health information, situational awareness among the partners related to infectious disease, and issuing public health alerts is also part of that information sharing. Depending on the risk factors and surveillance techniques, we might be looking at isolation or quarantine. I just want to make sure everybody understands that isolation is a physical separation of an individual or a group of people who are presenting with a contagious disease, and quarantine is the separation of people who have been exposed to a highly infectious disease during a period of communicability. So they don't necessarily have symptoms, but they have been exposed and could potentially become symptomatic. There are within the district plans for someone that does present not with just some of our more common infectious diseases, but someone that presents a very high risk or particularly for a what we call a high consequence infectious disease. The districts have, in most of them, identified one particular ambulance company that has undergone specialized training and actually has a special transport unit available so that it's easier for them to decontaminate the equipment after they transport an individual with a high consequence infectious disease. Also, the Indianapolis Metropolitan EMS is available to go anywhere in the state. So if there isn't if your local EMS is not comfortable transporting a patient, or if your district resources are not available, we can tap into the Indianapolis EMS system for them to transport individuals with high-risk infections. As we were preparing or developing plans to manage Ebola, basically three different terms for hospital settings were developed: assessment hospitals, treatment hospitals, and frontline hospitals. Frontline hospitals are ones that don't have the capability to do any specialized assessment or treatment of an individual with a high consequence disease. However, they may be where an individual presents until they can be transported to an more appropriate setting. An assessment hospital is a location where an individual would go for while they're under investigation, while their lab tests are being run, to rule out other types of diseases or to rule in a high consequence infectious disease. And there are currently 4 or 5 assessment hospitals in the state of Indiana. And there are no treatment hospitals in the state of Indiana, but I think the closest ones are in Chicago for our area. Another section in the plan talks about personal protective equipment, how we can share resources among the partners based on what is in our normal day-to-day inventory or that we have acquired for emergency situations. And also each district is developing a personal protective equipment stockpile or cache so that if there is an outbreak where a lot of personal protective equipment is needed in a relatively quick period of time, there will be strategically located personal protective equipment resources that can be distributed or deployed within a district. And the last area that those plans address is decontamination or waste, how you can properly, in the recommended methods to handle waste in biological waste. And it's also important to work directly with your emergency management agencies to know if there's a particular agency within your community that's responsible for waste disposal and environmental cleanup. Okay, another area that kind of goes along with this is the pandemic disease process. And the World Health Organization has identified 6 different phases for pandemic. Obviously, number 1 is a low risk. It means that there are very few cases reported in people, all the way up to number 6, which is definitely the pandemic, that there are a lot of transmissions among people. And just historically, in addition to just the general seasonal flu, we have had 3 to 4 pandemic flu outbreaks each century. One of the more recent ones that with a mild pandemic was in 2009 when the H1N1 influenza A virus infected about 20% of Americans. So pandemics occur when a new influenza virus emerges against which we have little or no immunity, and it spreads very rapidly. How this could impact your surgical center is obviously if 20% of the general population is infected, that means that probably 20% of your staff is also infected. So you have over a rapid period of time, a reduction of your staff. There may be a disruption in your ability to get supplies. The vendors may have staff shortages, or there may be shortages in the supplies themselves, depending on, again, the type of pathogen and what resources are utilized. There may just not be supplies available. And I know when we were all ramping up and trying to get prepared for an Ebola outbreak, it was very difficult to get the appropriate types of personal protective equipment. And unfortunately, supply and demand greatly affected that. The other thing is, that it might affect you because your patients are either too sick to come, so you have a lot of people canceling, or they're afraid to leave their home environment because they don't want to get exposed to an illness. So this would lead to a loss of business or revenue, business disruption within your center. So those are kind of some ways that a pandemic situation could affect decreased staffing, supply disruption, or a business loss based on a lower number of patients coming to your center. The healthcare coalitions, again, are planning for pandemic types of situations. As we talked on the last webinar about the capabilities for the healthcare coalitions, the capabilities also fit with the pandemic management. For healthcare system preparedness, we want to make sure that we're promoting community resiliency, plan and prepare with our partners, and train and exercise to identify gaps in those plans. Again, making that specific to a pandemic situation. From a healthcare system recovery capability standpoint, this is looking at your staffing and resource shortages and how you would recover from that, and how you would continue to maintain essential functions if there was a prolonged pandemic for maybe 6 to 8 weeks, how you would continue to maintain your business functions. Emergency operations coordination, talks about being able to make sure that they have a specific annex to your emergency operation plan related to pandemic outbreaks. You want to have a plan. That plan should include how to maintain essential services, the ability to assess triggers for surge capacity within the healthcare system and what resources are needed. And again, we talked at the last webinar about how the ASC fits in that healthcare coalition to help increase that bed capability and manage a surge. We need to be able to track resources that are available, and particularly those scarce resources. If it's a illness that involves respiratory systems, and ventilators could be in high demand. And there needs to be a process in place for interagency communication during a pandemic situation. Another capability is fatality management. How are we going to handle the surge of death? How are we going to manage reunification of families with the remains of loved ones, and always taking into consideration infection control and social distancing measures. The other thing that kind of fits into fatality management is dealing with mental and behavioral afflictions during and following a pandemic event. Another capability within the healthcare coalition planning is information sharing. What protocols do we have in place to provide situational awareness during a pandemic event? How are we going to do patient tracking and surveillance? Do we have interoperable communications so that we can talk to each other and have backups or redundant methods to communicate? What information are we going to share with the public, and how is that information going to be shared? And how the healthcare coalition partners request needed resources. There definitely needs to be a process within information sharing to know who to contact and how to get resources that you might need. Another capability within the healthcare coalition is medical surge. What infectious diseases trigger and what maybe quantity or type of infectious diseases would trigger us to expand our capabilities and capacities, and need to have plans in place to use different types of interventions to deal with that surge. Have you developed memorandums of understanding or mutual aid agreements to help manage a surge of individuals with infectious disease or a pandemic situation? Do we have plans to establish priorities of actions? How are we going to triage individuals? What spaces are we going to utilize? Are these all hospital spaces, or are there alternate care sites what staff are we going to be utilizing, particularly if, again, if we have that 20% reduction or affected general population. It could be even higher than that. Where are our staff going to be coming from? What supplies are we going to be using, and how we're going to monitor and get additional supplies? And we might also have to have some conversations about implementing crisis standards of care. And those would all be done in coordination with the State Department of Health and the health commissioners. Responder safety and health is another capability that the Healthcare Coalition addresses. What personal protective equipment is available, and what training have we done for people to know how to utilize that appropriately, and what types of equipment, PPE, is needed for different types of disease processes. Do we have interventions available to do vaccines or mass prophylaxis interventions? The health department typically manages this through their countermeasures capabilities. They might be setting up pods or points of distribution for the general public, and they might need to use a ambulatory surgery center as one of those stationary pod locations. Or I know another thing that the health departments are working with, particularly with hospitals and perhaps school systems and some of the larger clinics, as well as even some home health agencies, are what's called closed pods, where if there is a pandemic event, that you would be responsible for making sure that your own staff and their family members receive the appropriate interventions to keep them safe. And the last area is talking about volunteer management. This could be medical volunteers or even non-medical volunteers. And one of the best things that you and your staff can do is make sure that you do get registered on Serve Indiana, so that if for some reason your surgery center is not open, then the hospitals and or health departments can contact your staff to find out where they would be most appropriately utilized in a pandemic type of a situation. The next area I kind of want to explore is infection prevention, and there are basically 3 steps that I want to talk about here. Identification. Do you have a screening process so when individuals come to your center for their procedures, do you have particular questions that you ask regarding foreign travel, for instance, or do you ask if they've had any recent signs or symptoms of flu-like illness or been exposed to that prior to coming to the center for their procedure? If the answer to either of those is yes, then you would want to isolate that individual in a private location, preferably somewhere with a private bathroom, or if not, depending on how long they're going to be there, you might need to provide a covered commode. It's always best to try to have that room close to wherever the patient is at the time of their screening. You don't want your isolation room to be the furthest treatment location away from your waiting area or point of arrival. If someone says that they, have a positive screening, you don't want to walk them through your entire center to get back to an identified isolation area. So I kind of think when you're determining where those isolation rooms are, the patient flow to get to that isolation room needs to be very minimal. If you do identify someone with a positive screen, you want to avoid any unnecessary direct contact and perhaps utilize appropriate personal protective equipment if necessary. Only essential staff should be involved with that person. And while they're in an isolation process until they can be transitioned away from your center, please keep a log of everyone that has had any type of contact or exposure with that person so that they can be monitored if appropriate. Obviously, you would not want to do any interventions or procedures on an individual that you've identified with a positive screen for an infectious disease. And if you do set up an area for isolation, just go ahead and pre-print some signs so that people know that that area is off limits, that precautions need to be taken if they are in that area. The last kind of thing about infection prevention is information. Protect the individual's confidentiality, share only essential information with staff, and you would want to quickly identify the local health department or the Indiana State Department of Health to make arrangements for safe transport, particularly if that is an individual that's suspected of a high consequence infectious disease process, to make sure that the coalition plan or the state plan for transporting that individual is implemented appropriately. As a center, you want to work towards preventing transmission of infection. You need to take administrative measures to make sure that you have sufficient and appropriate equipment and supplies available for standard precautions, including hand hygiene products, injection equipment, and personal protective equipment. You want to make sure that you have plans for how you're going to train individuals regarding infection prevention. Obviously, you want to have a written policies established and make those available to your staff. You want to accomplish a risk assessment in order to prioritize your resources and focus your attention on areas that you've determined to be great risk. For example, in the surgery center, you might have, some of you might need to focus on on-site sterilization or how you handle reusable surgical devices, depending on the types of procedures that you do. And then you also need to address occupational health, including vaccination of your staff, how you're going to manage staff exposure or post-exposure. Do you have work restrictions that you might be put into place, and making sure, too, that you're compliant with all of the OSHA bloodborne pathogen standards. You want to, as I mentioned before, educate and train your staff, cover basic principles and practices for preventing the spread of infections and any special procedures depending on the types of patients and procedures that you perform at your clinic or your surgery center. You need to establish a method of surveillance, monitor and report particularly healthcare-associated infections by doing a systematic collection and analysis of data regarding these events. And you want to track not only health-associated infections, but also process measures like hand hygiene and environmental cleaning to help prevent the spread of hospital-acquired or healthcare-associated infections. This can be difficult in the ambulatory surgery center because your patients aren't with you very long. Your encounters are typically kind of brief, and further evaluation and treatment as a consequence of any infections may be at a different healthcare setting, maybe at a physician's office or the hospital. So it's very important to be able to do that good surveillance, that you make your patients aware of any signs and symptoms of infections and instruct them to notify you if they notice any of these occurring, so that you can do reportable disease or report any outbreaks. You should also do regular focused surveys or audits regarding hand hygiene, medication handling, point of care devices, single-use device reprocessing, endoscope reprocessing, or sterilization and high-level disinfection processes. So again, depending on what kind of procedures you do, you want to kind of do self-audits to make sure that you're doing appropriately handling those devices and managing them. Another way to prevent transmission of infections is following standard precautions. Again, using hand hygiene, appropriate personal protective equipment, which might include gloves, gowns, or masks, making sure that you're following safe injection practices to avoid needle sticks, that you're handling potentially contaminated equipment or surfaces. You do have good cleaning processes between patient procedures, and that we have good education and reinforcement of respiratory hygiene and cough etiquette. So the plan that you develop for dealing with infectious diseases or pandemics, again, as I said, it is an annex or is a part of your all hazards emergency operation plan. Some of the things that you want to have in there are how you're going to do that surveillance, detection, monitor, and report infectious diseases, how you're going to monitor public health advisories that are coming out from the CDC or the State Department of Health, epidemiological reports, making sure someone is kind of tracking those, and how you need to report unusual cases or clusters of cases to make sure that we don't have an outbreak potential. Communication is always an important piece of your emergency operations as well as your infectious disease and pandemic plan. You need to know who are your points of contact. Each county has a local health department contact, and each district has a field epidemiologist that can be contacted, and so you need to know who those individuals are and how to get in touch with them. It's very important, too, that you have a process in place in your communication plan on how you're going to work and communicate information, share information with your partners, as well as just general public education. Staff education, training, and management is important. Staff need to be aware of the plans. Again, if we're dealing with 20 to 30% staff reduction, you have to have a good succession plan and cross-training. You might have to develop some flexible hours in order to continue to not have lost revenue during a pandemic type of a situation. Obviously, how you're going to manage your patients should be part of that plan. You may need to temporarily restrict the number of people that come with each individual patient. I know in the hospital settings, they frequently, in high flu seasons, have visitor restrictions, and you might need to kind of look at that. If you have individuals coming in for procedures, that they don't bring a lot of family members with them or children with them. Make sure that you do have those good screening processes, that you do have a location for isolation, you have the appropriate personal protective equipment, consumables to manage individuals with infectious disease or in a pandemic situation, and how you're going to deal with potential supply shortages. You need to have a good infection control plan. Again, that isolation process, good hand hygiene, respiratory and cough etiquette, and make sure you have signage that you can put up to help educate not only your staff but the general public on respiratory cough etiquette and hand washing hygiene. You might need to make masks available and as well as make sure that your staff understands standard and droplet precautions. Vaccinations and antiviral interventions might be necessary where you get the appropriate vaccines, or like seasonal flu. Is this a voluntary for your staff, or do you require or make it mandatory that your staff gets seasonal flu vaccines or hepatitis B vaccinations? And develop priorities for how those might be administered, particularly in a pandemic situation. Is it just going to be staff, or can you get enough resources to vaccinate or do mass prophylaxis for not only your staff but also their family members? You have a good occupational health plan to determine that if an individual becomes ill at work, how they're going to be managed, when they can return to work. If they're symptomatic but well enough to return to work, can they be placed in areas where they have little contact with others but can still be a productive employee? How you're going to manage individuals that need to stay at home to care for ill family members, and also those that may be pregnant or immunocompromised workers. Might it be necessary to put them on a leave of absence or in an altered work location to protect them during those processes? Environmental cleaning is another area that you need to address in your infectious disease and pandemic plan, making sure, again, that your staff have appropriate training, or if you contract that service out, that their staff have appropriate training, that they're using the appropriate products, you know how to dispose appropriately of waste, and particularly contaminated waste, how you're going to manage spill decontamination, particularly blood and body fluids, and the process that they use, that's used between procedural cleans as well as what we call terminal clean at the end of the day. Do you have appropriate ventilation in your procedure areas for infection control, and how you're doing your device reprocessing are very important aspects of that environmental plan. Some additional things to kind of think about when you're dealing with particularly a pandemic plan. Again, you want to make sure your business continuity plan includes training enough people to handle essential functions and alternate ways to get critical supplies. You want to inform your employees about your plan for coping with the additional surge during a pandemic event. You want to prepare for potentially high absenteeism by cross-training your staff members. Protect workers by asking sick employees to stay at home and advising all staff members to monitor themselves for fevers, particularly with respiratory illnesses. Plan for a surge of patients and increased demands for services that might be coming to your surgery center. Maybe it may just be individuals calling in. You may have a high demand on your phone systems for individuals calling in and asking questions of whether they should come or not come or getting rescheduled. Develop a plan to screen your patients for respiratory illnesses when they enter your facility and how you're going to isolate them. If you have a positive screen, you want to take steps to ensure that your staff that have been exposed to suspected flu patients have respiratory and eye protection or other types of personal protective equipment to prevent them from further exposure. It might be necessary to postpone healthy patients' appointments due to staff absenteeism and to protect your other patients from exposure to the flu when cases are peaking. you might need to, again, provide vaccines or immunizations against seasonal flu, as well as pandemic strains that might be circulating. You want to make sure that your planning and your response activities of your healthcare partners are solid, and that you've collaborated with them so that everybody is kind of following the same processes. And know where to turn for additional information. What other resources are out there, such as different websites, either state or federal websites. And one of the couple of things that I sent those that have pre-registered, we sent you a checklist of things that should be included in your pandemic or infectious disease plan. And I believe on the end of that is a list of several different websites that have a multitude of information on how to manage and deal with a infectious disease or a pandemic type of a situation. The other thing that we sent you was Ebola screening or patient questionnaire, kind of a flow process. There is a disclaimer on there that the CDC is no longer updating that because there isn't a high transmission probability for Ebola at this point. So that document, as printed or given to you today, is the most current from the CDC, with no plans to continue to update that. You need to just continue, though, to reduce the risk of illness. You know, we've talked about, you know, what plans and how you're going to manage it if it happens, but really keeping your staff informed, engaging, and being able to understand potential risks, giving those flu vaccines, boosters when they're due, and the seasonal flu shots. Making sure that you have alcohol-based hand sanitizers in the bathrooms and kitchens, as well as your patient care areas, and that you follow that good respiratory and cough etiquette, covering your mouth to prevent a spread of particles, and that you have equipment, if necessary, for face masks and gloves. Is there a possibility that some of your staff could telecommunicate or work from home if possible if they're not feeling well? And, you know, just keeping things clean. Obviously, patient care areas, common areas, kitchens, countertops, conference rooms, services, computer stations are one of the dirtiest. You know, when they do studies, they find computer stations and phones are some of the least clean devices that we have in our workstations, as well as door jambs and door handles. So make sure that you don't leave those areas out. So hopefully that's given you some ideas of the kind of the different types of infectious diseases and pandemic situations that we are currently threatened by or potentially could be emerging, as well as what your coalition plans are to deal with these types of situations, and looking at what your individual setting or surgery center needs to do in preparation for a infectious disease or a pandemic type of a situation. So that concludes the webinar for today. I just want to, on behalf of Anne, remind you that the deadline for completing your emergency preparedness IFASC survey is June 30th, and if you've not completed that and need assistance with that, please contact Anne Haddix to complete that by the end of this month. Okay, we have one additional training. It's the rescheduled active shooter training in the North region. will be Monday from 2 to 4 at the Catchment Auditorium at Lutheran Hospital. And again, if you've called in to the webinar or have additional people with you at the webinar, please send either myself or Jeff an email, and we'll make sure that you do get a certificate for today's training.